Hi, my name is Kevin Long. I'm the lead nurse for the Travel Health Clinic at Appalachian State University Student Health Service. For the purposes of our conversation today, we're going to encompass 10 countries in Western Europe. Those countries are France, Italy, Germany, the UK, Switzerland, Ireland, Austria, Netherlands, Belgium, and Denmark. All of these countries have very similar diseases and concerns, and so we will go through those with any exceptions. One of the key components to international travel and responsible international travel is being well vaccinated. We have a responsibility to the places we travel not to bring diseases into their country. We'll run down through the different ones that are important for Western Europe, what they are, and what you might need. Vaccine preventable diseases: Hep A, Hep B, influenza, measles, mumps, rubella, meningitis, tetanus, Tdap, rabies, tick-borne encephalitis. Of these, some of them are vaccines that are not available in the United States, and we'll discuss that as well. Hepatitis A is a foodborne pathogen. It is a problem in the United States as well as overseas. I recommend that you get at least one dose, if not two, prior to going. It is something that will benefit you throughout the rest of your life. Hepatitis B is a bloodborne pathogen. It is required for college, so therefore it is likely that every student who is traveling will already have that. If not, then it is something we should certainly consider and make available to you. Measles, mumps, rubella are vaccines that are given frequently in the United States early in your life. It is unlikely that you do not have measles, mumps, rubella unless you, for some reason, were against vaccines as a whole. Measles, also known as rubeola or red measles, is highly contagious. Measles is particularly a problem in Western Europe because of migration of individuals from unvaccinated countries. The measles, mumps, and rubella is transmitted via droplets from an infected person coughing or sneezing, and the uninfected person breathing in those droplets. Varicella, or chickenpox as it's commonly known, is highly contagious. It is unlikely that you would not have had the vaccine or the disease. If you have had 2 doses of chickenpox or varicella, then you do not need to have any further vaccination. If you had the disease, whether you had 1 or 2 shots of varicella vaccination, you do not need to be vaccinated. Varicella, or chickenpox, is transmitted person to person, primarily by inhalation of droplets, once again, through coughing or sneezing of an infected individual. Rabies is not a big issue in Western Europe. However, it does still exist, as it does still exist in the United States. Although it is highly unlikely that you would encounter an animal that has rabies, it is unadvisable to interact one-on-one with any animal while traveling abroad. A bite, scratch, or lick is all that is required to transmit rabies from one to another. The most common carrier of rabies is canine and bat. If you are working in a shelter with injured animals, we might talk differently. So if you find out that you're going to be, you need to give me a call and let me know that. Meningitis is thought to be required in all students. However, it is not a requirement, and therefore a large number of students do not have the vaccination or have not been vaccinated in the last 5 years. Meningitis conjugated C is a strain that is highly prevalent in Western Europe, and it is a standalone vaccination in childhood there. It is not advisable for anyone traveling to Western Europe get that vaccination as long as they have had a meningitis vaccination in the United States within the last 5 years. There are several at-risk groups: college students living in dorms, international travel, and international travel to the meningitis belt, which is in Africa. Since at least 2 of those will apply to you, it is recommended that you have a meningitis vaccination within the last 5 years. Tick-borne encephalitis is something that is vaccinated for in Western Europe. However, in the United States, we do not vaccinate for it. I do not recommend that you get a vaccine while you are there for it. The recommendation is following good insect precautions. Tetanus diphtheria or tetanus diphtheria and acellular pertussis, commonly known as the tetanus booster and Tdap. In the United States, tetanus is considered good for 10 years. When you go overseas, it's only considered good for 5 years. The reason behind that is if you were to step on a nail 5 years and a month after your last tetanus vaccination, you will likely get a revaccination at that time. We prefer that you be vaccinated fully before you go abroad, so if you should have such an encounter or incident, that you do not need to worry about getting a vaccination while traveling. The big thing to remember about influenza, it is biologically impossible to get the flu from the flu shot. It is a immune response that some people are feeling and mistake for influenza. Imagine being on a plane for 10 hours or more, sitting next to someone who has influenza or the flu, and the chances of you getting it go up astronomically high. Frequently, I'm asked, what is the flu season? The flu season is 24 hours a day, 7 days a week, 365 days in the year. There is high peak season and low season. And during that high peak season, we normally see November to December start through February, March, sometimes April. For the most part, though, anything in the Western Hemisphere is on the same flu season as what is in the United States. Travelers immunized with a current formulation more than 6 months earlier than your travel should get revaccinated or at least discuss with an immunization consultant whether or not that would be necessary for their trip. In Western Europe, travelers' diarrhea tends not to be much of a problem. If you were to experience sudden onset of diarrhea, you could take Imodium or loperamide. If that does not work on its own, then I would recommend seeking medical care for further treatment. One of the frequent questions I get is regarding malaria in Western Europe. There is no malaria in Western Europe, so that should not be a concern. Other vector-borne diseases are present, but malaria is not. The best way to create a barrier for insects is by using DEET. DEET 30 to 40% is what is recommended. Anything lower than 30% is not strong enough. Anything greater than 40%, you run the risk of burning your skin. The application of bug spray should be a minimum of 4 times a day when you're in an at-risk environment. You would cover all exposed areas of skin. I also recommend applying it over clothing. Put some in your hands, rub it on your face, the back of your neck, the back of your ears. I also rub my hands through my hair just to be extra cautious. The bottle will say, or the can will say, not to apply to clothing. That is because it is a greasy substance and they do not want to buy new clothing. If you are wearing clothing that is super nice, I would not recommend that. Otherwise, I would recommend applying it a fine mist over every part of your body. A common way to remember when to apply your bug spray is first thing in the morning, or we call it breakfast, lunch, dinner, and bedtime. Breakfast is first thing in the morning, lunch at lunchtime, dinner at dinner time. Your bedtime dose is when it starts to get dark. That should cover you through the peak times where you would be at risk, as well as the peak times you would be sweating it off. There are several insect-driven diseases that there is no vaccination for. Dengue fever is one of them. It is only in France and it exists in the urban and rural areas along the Mediterranean coast. Transmission primarily occurs August through October, and travelers should observe daytime insect precautions. West Nile virus is an issue in certain countries within Western Europe. However, if you are following insect precautions as discussed in this course, then you should have little to no problems. Ricksettia infection is a low risk throughout most of Western Europe. You should follow the recommendations of insect precautions when in an at-risk environment. Once again, an at-risk environment is wooded areas, hiking, that type of thing. Ricksettia infections are commonly transmitted by mites, very frequently related to rodents. The risk for Lyme disease in Western Europe is very similar to what we would have in the United States. Once again, using insect precautions when you're in an at-risk environment is recommended. Schistosomiasis is only a risk on the Cavo River near St. Lucio di Porto Vecchio, Corsica. Bottom line is, if you're looking at getting in fresh water, if you can't tell the water's moving, don't get in it. If you can't see the bottom, don't get in it. Hantavirus is primarily a risk in Austria. It comes from rodents and their excrement. What happens is someone sweeps, the feces along with dust gets aerosolized, and you breathe it in. That is how hantavirus is transmitted. Helminth disease comes from eating lettuce that is not well washed. It can also come from walking barefoot on the ground. It is not recommended that you do that in Italy. Marine hazards. Risk from jellyfish exists in the Mediterranean Sea for France and Italy. They include the highly venomous Carabidea, Marsupialis, and Portuguese man of war, and the mauve stinger. Travelers wading, launching boats, or fishing are especially at risk. Risk from sea urchin also exists, and you should heed the local posted warnings. Watch for the local fishermen, because if the local fishermen are not launching their boats from the shore, probably a good indication that getting in is not a good idea. Air pollution can be an issue in any major city. It is recommended that all travelers carry with them at least 1 to 2 bandanas so that you can pour bottled water on it, wring it out, and use it as a particulate mask if you should be having trouble. Most people have trouble when they are having long-term exposure and or exertional activity. The countries in Western Europe that we've identified are all considered high income or advanced countries. So what that means for you is they're going to be relatively what we would consider westernized. Obviously, there will be different languages in different countries. From a security standpoint, petty theft is a concern. Certainly, you want to be aware of your surroundings at all times. Don't have your purse just flapping on your back. If you're in a crowd, move your backpack from your back to your front. Make yourself less of a target by doing the security kind of awareness. Key security threats include terrorist concerns, violent crime, and petty crime have been known to occur through Western Europe, especially in areas frequented by tourists and on public transportation. Petty crime includes using the distraction technique to commit these robberies. Additional threats to personal safety include protests and demonstrations, which have the potential to turn violent without warning and can disrupt transportation. It is recommended that you not be in the area of one of these. If you encounter one, please go around or turn around and go the opposite direction. Intentional drugging of food or drink has been known to occur to aid in these robberies. There's a high level of medical care throughout Western Europe. If you're traveling through App State, Office of International Education and Development, or through a program sponsored by App State, you will be required to have travel insurance through GeoBlue. That becomes a part of your overall trip costs. They have an excellent app. Once you download it and register, if you need a clinic or hospital, it will tell you the closest one to your current location. Do you have any questions?
I do not.
Okay. If anything changes, certainly reach out to me. If you find out you're going to be in any of those at-risk environments, caving or what have you, then certainly I want you to reach out to me.